During the COVID-19 pandemic, it was discovered that state hospitals in the Erongo region desperately needed oxygen concentrators to treat patients. According to the Erongo Red Chief Executive Officer, the state facilities ended up rationing the equipment between patients in the hospitals and those receiving care at home. Oxygen concentrators are crucial for medical facilities because they are used to deliver oxygen to patients with respiratory-related disorders or severe lung issues.
We are really, as a team, aware about ongoing shortages of oxygen concentrators and other equipment. Recently, at our board meeting, we also approved what we call the contingency fund. Contingency fund is something that is managed from within office of the CEO. And if there are things that are unknown to us at the time that we are doing our budgets, maybe like these ones and many others, then it is incumbent upon my office to say, here is like 100,000 for you, or here is a 500,000. The intention really is how responsive can you be as a company.
The Chief Medical Officer at the Ministry of Health said various hospitals still need oxygen concentrators despite the end of COVID-19 pandemic. He stressed that chronic respiratory diseases are in the top 10 causes of death in the Erongo region based on last year's annual report.
Many of the conditions, starting from lung cancers, chronic obstructive diseases, pneumonias, bronchitis, pneumoconiosis. We know we have got mines, people are working in the mines. They're also exposed to dust and other chemicals that can cause chronic respiratory conditions. And when the lungs are affected, because the lungs are reserves of oxygen, we start having shortage of oxygen. And some of these conditions cannot just be treated in the hospital, because now it becomes chronic, it becomes long-standing conditions, and then this person will need supplemental oxygen for a long time.
The 7 concentrators, worth $225,000, will be availed to the state hospitals at Swakopmund, Usagos, and Omaruru. Erongo Red will further spend $35,000 to repair and replace street lights outside the hospitals. Renata Renkura, NBC News, Walvis Bay.